The focus is absolutely the patients, and I think that avoidable hospitalizations it's an outcome that is of interest to policymakers because it absolutely epitomizes unnecessary healthcare spending and waste in our system. If we are providing unwanted and unnecessary aggressive care in the most expensive settings possible, it's clear why policymakers would be interested in this. But it's an important patient-centered outcome. Many of these residents have dementia. A majority of them have cognitive impairment. And to transfer someone with cognitive impairment in particular to an emergency department where they may spend 10 hours or more on a gurney in an emergency department getting blood draws, getting IVs put in for care that they do not want or maybe could have been provided safely in their own home, in the nursing home, it's a lot of burden on the patient. It's also a lot of burden on the nursing home staff to be transferring people out and bringing them back. It takes a lot of work to do that safely. So I think it is an important patient-centered, family-centered outcome, and it's also a great one to pick because of the healthcare spending issues that it highlights. Nursing homes are operating in a changing world right now. The accountable care organizations, the shared saving programs are causing many providers in the healthcare world to change how they're doing business, and nursing homes are no exception to this. Nursing homes rely on hospitals for their referrals to fill their beds with rehab patients, and so nursing homes respond to the pressures that hospitals respond to because they have to. Thus, the focus on readmissions that hospitals have been feeling, which has caused hospitals to actually start reaching into nursing homes and sending staff into nursing homes, and to look to partner with nursing homes who are good at treating people in place and who don't transfer unnecessarily, has caused the whole nursing home world to think a lot about this issue, certainly of rehospitalizations, but then of hospitalizations overall. Certainly our project has significant personnel costs associated with it. In order to do our project, we have placed trained professionals, RNs in each of these buildings and the nurse practitioners. And it's not just their salaries, but the amount of training that we have given them in order to implement these policies and practices. So a nursing home who wants to implement these needs to dedicate serious FTE within their existing structure or bring in outside consultants like us in order to implement these. It is very hard. And also, nursing homes are more and more adopting electronic medical records. And so if these tools need to be integrated into the electronic medical record, which they do in order to make them part of the workflow, there's expense and training time associated with that as well. A lot of it is about setting priorities, and the more that readmissions, rehospitalizations, hospitalizations in general are a priority in the nursing facility setting, the more they will be interested in devoting resources towards it. The demonstration projects like ours, funded by the Innovation Center, are specifically designed to test new models of care. If they are successful, the goal is that they will be scaled up with support from CMS. And that's my hope, that nursing facilities will receive more resources in order specifically to implement these quality-based programs.